Doctors demand end to fitness for work tests. Britain's doctors have voted at the British Medical Association's annual representative meeting to demand an end to the government's controversial fitness for work tests and to work with disability charities to campaign for it to be scrapped. Doctors want the Work Capability Assessment, WCA, replaced with a rigorous and safe system that does not cause avoidable harm to patients. The motion said the computer-based assessments have little regard to the nature or complexity of the needs of long-term sick and disabled persons. GP Louise Irvine, who proposed the motion, said the tests had left many patients in a state of high distress, with thousands of long-term sick patients wrongly characterised as fit for work. She said the implementation of the WCA, introduced by Labour in 2008, had been disastrous, while the test was simply not capable of assessing ability to work in any meaningful way. She criticised the way the clunky, insensitive system had led to the McDonald'sization of doctors who carry out the assessments on behalf of a company, Atos Healthcare. The assessment has caused mounting anger among disabled activists and benefit claimants since its introduction. The Department for Work and Pensions refused to comment on the vote. Atos assessors told to keep approvals low, secret Channel 4 film shows. Secret filming of training given to doctors recruited by Atos to assess whether sickness and disability benefit applicants are fit for work suggests that staff are monitored to ensure they do not find excessive numbers of claimants eligible. The film also demonstrates the unease about the radically heightened eligibility criteria felt by some trainers employed by Atos to teach new recruits how to carry out the tests. It is now harder for some very severely disabled claimants to qualify for support. No matter how serious claimants' problems are with their arms, for example, as long as you've got one finger and you can press a button, they would be found fit for work, a trainer explains. A GP with 20 years' experience applied for a job as an assessor with Atos and secretly filmed his training for Channel 4's Dispatches programme. The film shows him being told by his trainer that he will be watched carefully over the number of applicants he found eligible for the highest rate of disability payments. The trainer tells trainee assessors, if it's more than I think 12 or 13%, you'll be fed back. Your rate is too high. When questioned how the company could know in advance the precise proportion of people who needed to be put in this category, the trainer replied, "How do we know? I don't know who set the criteria, but that's what we're being told." The DWP said it was nonsense to suggest that there were targets or expected results of any sort. Assessors' results were monitored to make sure they adhered to an average. In the footage, one of the trainers admits during a session that the auditing process makes her feel uncomfortable. There are no jobs for healthy people, but we have to think this way, and sometimes you feel awful. This has been taken from The Guardian. High Court Challenge. The Public Law Project has helped 2 people with mental health conditions gain leave to appeal to the High Court about the operation of Atos medical tests. Their case is that the Equality Act 2010 requires the DWP to make reasonable adjustments to avoid disadvantage. The reasonable adjustments they seek is that Atos and the DWP should seek medical evidence at the very outset of a person making a claim. This has been taken from the Social Welfare Training newsletter. Atos Chief's £1 million bonus. You may not be entirely surprised to learn that the boss of Atos has recently received a £1 million bonus. However, Atos support workers have voted by 95% to reject a below-inflation pay offer and may strike, which could close medical centres. See wired-gov.net for the full story. tinyurl.com/C3K7JTN